Laboratory diagnosis of RNA HIV virus, human immunodeficiency virus. Start writing the diagram that will be asked in your examination. It is a HIV enveloped virus, RNA virus. It has got. Don't make noise, please. Although it looks like flower, but it is infection is not very flowery. Why are you making so much of noise? Please keep quiet. What is happening? Don't make noise. So it has got antigen, glycoprotein 140, and this is glycoprotein 21, glycoprotein 140 and glycoprotein 21, and it has got two identical RNAs, and it has got an enzyme called reverse transcriptase enzyme, and it has got nucleocapsid which is made up of P18, and it has got one more covering which is made up of P24. This is a virus which is called as, all of you should practice and you should be able to write the diagram in your examination. This is the most commonly asked question in your examination. HIV virus was discovered by Luc Montagnier and Robert Gallo. One is French and one is American. So both of them claiming they should be given the name for the discovery, but still they are contesting the court of law. So first it was discovered in Haiti, and probably it was suddenly they started assisting the parasitic infection like pneumocystis carinii, lot of pneumonia in gays. Everybody was happy thinking that it is a infection of gays. Suddenly they found this infection in bisexuals also and heterosexuals also. So now this this infection became infection next door, and it is transmitted from person to person. Confirmed mode of transmission: number 1, blood transfusion; number 2, mother to child, vertical child transfusion; number 3, needle stick injury; number 4, breast milk. And important is STD, sexually transmitted disease. These are the confirmed mode of transmission from person to person. These are the confirmed mode of transmission from person to person. So they have affinity. They have a special receptor for. There are two types of. You must have already knowing that pluripotent stem cells gives rise to granulocytes and the lymphocytes and monocytes. Stem cells is mother of all cells. From there, lymphocytes, one migrate to thymus, rudimentary organ like appendix, where they are coached, tutored and armored, taught, graduated from thymus, and they produce T lymphocyte, T for thymus, and they produce lymphokines, and they are important for killing of intracellular pathogens and play important role in organ transplant. Lymphokines, and there are two subsets of cells, T4 cells. These are called helper cells, and T8 cells. These are called suppressor cells. These are called suppressor cells. T4, and there are one more type of lymphocyte. They are called NK cells. NK stands for natural killer cells. NK cells stands for natural killer cells. Now, other lymphocytes migrate to bone marrow. Similar organ in birds called Bursa fabricius. They get tutored, coached, and graduated in bone marrow. They transformed into plasma cells, B lymphocytes. B lymphocytes, upon antigenic stimulation, transformed into plasma cells, and these produce IgG, IgM, IgD, IgA, IgE. These are responsible for CMI. These are responsible for EMI. EMI, antibody mediated immunity, and cell mediated immunity. Both are interrelated, both act together. So, thymus derived are T lymphocytes, and bone marrow derived are B lymphocytes. B lymphocytes transformed into plasma cells. Plasma cells produce antibodies. There are 5 antibodies. IgG passes the placenta barrier. IgA is secretory antibody. IgM is exclusively intravascular antibody. IgE mediates hypersensitivity. IgD, nothing much is known. So this is about immunity. Now this HIV virus has got special affinity towards T4 lymphocytes. Which lymphocytes? T4 lymphocytes. So, and they enter and they multiply. Once they are full, they attack the new cell, new T lymphocytes. So once the CD4 count, CD also stands for a cluster of differentiation. Depending on the antigen, they are classified into CD4 and CD8. T4 cells goes down less than 200 cells. We start ART. Heart. ART stands for antiretroviral therapy. ART stands for highly active antiretroviral therapy. ART stands for highly active antiretroviral therapy. Man becomes immunocompromised. Man becomes immunocompromised. Totally becomes its system breaks down. So there will be more of hypergammaglobulinemia and less of say cell mediated immunity, and in fact totally both cell mediated as well as antibody mediated immunity both are gone. So he becomes victim of all infection. So first of all, he get infected with tuberculosis, then salmonella, pneumocystis carinii, cyclospora, fungal infections, candida, cryptococcus. All opportunistic infection, you do not have any resisting power. Become victim of all opportunistic infection. Once you diagnose tuberculosis, all the patients who are down with tuberculosis, we have to screen them for HIV. HIV. Who needs HIV testing? Who needs HIV testing? Drug abuser. Okay. Drug abuser. One. Next. Shankar, where you disappeared? Morning you are not there. Remove your mask. All blood should be screened. Blood banks, blood donors should be screened. Okay, next. Commercial sex workers. Okay, next. Bhanu Prakash. 90. Bhanu Prakash 60. Is not there. Is not come. A batch. Okay. Who else? Nayak. Nayak. Who needs HIV testing? Vaibhav. What's your name? Mohit. बोलो. ब्लड ट्रांसफ्यूजन हो गया ना. नेक्स्ट. सिद्दीक. After? What is that? After? No, you can't do that. Siddiq, stand up. You are a doctor, consultant physician. You know you are treating with antiretroviral drug. Mainly I have treated so many cases. Suddenly one HIV patient comes to you with a nice glossy card, wedding card, gives to you. I'm getting married next in Palace Grounds. I'm getting Mercedes Benz and I'm getting so much of gold dowry and all those things. What is your advice? What is your take on it? What? Then he will screw another 20 people and give HIV to everybody. He will have sex with other 20 people and give HIV to everybody. Sit on, Vishnuvardhan. Children born to HIV mother. Okay. Chalo. Next. Balaji, बोलिए. हाँ? NSI. Yes, very good. Next. What is your name? Umesh. Mahesh. Okay. Who needs HIV testing? Next. Next. Huh? Why you want to do all health worker HIV testing? Nobody will work then. If you catch hold of them, nobody will work. They will run away. Next, what is your name? Naik. Rajat. Rajat. It is Naik. Sit down. Sit down. Sit down. No, not you. I asked one question that somebody comes, you are treating them with for anti-HIV drugs, antiretroviral drugs, and he comes with a card. What is your advice? Chalo, next. What's your name? Deepesh. Bolo. Next. What is your name? Huh? Sai Charan. Bolo. Sit down. Next. Balaji. Maruti, sorry. Balaji is here. Yeah. Sit down. Okay. You tell me who needs HIV testing. Maruti. Yeah. No. Why you need HIV testing? You want to undergo HIV testing? Next. What's your name? Next. Sit down. Most important you forgot was sit down. Sit down. There is something called all pregnant women should undergo pregnancy. An antenatal checkup include HIV testing. Antenatal checkup needs HIV testing so that we can prevent mother to child transmission by giving a single dose of nevirapine, which has got a half-life of 48 hours before delivery. Can prevent. Has drastically come down by earlier we used to call it as mother to child transmission control program, MCTCT. Now it has changed. Mothers went to the court saying that why we are alone responsible for HIV. Both husband and wife, both together should undergo testing. Most of the time, husband do not come for testing, but still we call. The counselor is there. We'll call both the partners for testing and they test for HIV. The pregnancy is one important. And all surgical procedures, they have to all surgical procedure, that is called serovirology, before doing any surgery. So all obstetrician, what you want, whether when you are when you are doing operations, you should be protected yourself, and that's why we use double gloves, double aprons, shoes, everything. Whatever used on HIV patient, fully discarded. Fully discarded. So it costs, if you want to do, you cannot deny any HIV patient any treatment. Will be put immediately into the prison. You cannot deny anybody of HIV infection. But there is a risk of acquiring infection by needle stick injury. By needle stick injury. So you have to be double careful while operating the HIV patient. You cannot deny for the treatment of HIV patient. So all surgical procedures, and we always, it is all hidden. How you take LIC policy or something, so many 10-12 pages. Before that we take a signature. All the procedure necessary for undergoing operation will be done. So for that the patient, first of all, he will be in agony, he will sign it. In that HIV, HBsAg, HCV will be there. We are going to test. Will not be told, but the alert when patient comes to you, and now all the other screening methods is all Hep B patient, diabetes mellitus patient with tuberculosis. All tuberculosis patients are screened for HIV, and some places this is a pre-employment. Before getting employed in any hospitals or any software, any companies, corporate companies, it's a must. pre-employment procedure, it is a must. And somebody has gone to the court, and some people are not doing it. Here also getting a post in any post, whether assistant professor or registrar, we have to undergo HIV testing. I am HIV negative, don't worry. It is not transmitted by any other route. This is whatever the route and anything like that. Kissing is not a mode of transmission. You know any idea? Kissing is not a mode of. They have tried this also. 1 ton of saliva from HIV patient put into the mouth of another HIV negative patient is not transmission. And all the time, whenever we give a lecture on HIV, sir, one question. Mosquitoes. Can mosquito transmit HIV from one person? No. Kissing will not transmit. Handshaking will not transmit. Using a commode will not transmit. Using a same soap will not transmit. All these things are not. But be careful about ear piercing, nose piercing, and tattooing. And all are responsible for transmission of this. These are all comes under needle stick injuries. Needle stick injuries. These are all any other you want to add HIV testing to be done. Pre-employment 1, pregnancy 2, tuberculosis 3, surgical procedure, pregnancy, all these things, and suddenly somebody loses 10 kgs of weight. Suddenly some people lose and becomes victim of fungal infection, candida, oral thrush, and moniliasis, and so many other things. Suddenly, if you see an opportunistic infection, that calls for HIV testing with the consent. There is something called ICTC. There is something called, you must visit this center. You see how people are counseled about HIV. You should learn how to counsel, and you should know as a doctor, that is ATCOM, that is attitude, ethics, and communication. So asking that is not taught in medical colleges or medical school. I already told you about it. One is declaring somebody dead in the ward or operation theatre, or asking history of sexual exposure. And you should not ask how long you slept, how did you sleep, what was the position, which was the girl, how much money you offered. That is not the question. That's not the way of. You have to ask plainly history of sexual exposure with a commercial sex worker. Plain question. There is no hitchkitch. There is no this thing. Just ask questions. So no problem. The patient will have full faith in doctors, and confidentiality about that patient should be maintained. You should not go and discuss with other people that, oh, that fellow is HIV positive. We will put you in jail. We will sue you for crores of rupees if you really reveal the identity of patient. In ICTC, this is called Integral Counseling and Testing Center. All the patients are counseled for HIV. What is HIV, and what are the complications of HIV? What are the infections that are going to get? What are the opportunistic infections? What will happen? And all those things they will be counseled, and their name will not be written down in any of the requisition form. Their name is kept confidential. Only some number is given. Only some number is given. Name is kept confidential. If he says, "You please don't reveal my HIV status to my wife and relatives," it will not be revealed. If he says, "Don't reveal it to anybody except my doctor," it will be kept confidential. That is a confidentiality. Tomorrow I am going to speak to you about the respect and compliance of the patient during taking up something. A lot of things we do without telling patient what you are doing. Actually, when taking blood pressure, when you are taking a blood pressure, when you are taking a pulse, when you are taking a temperature, when you are doing some procedure, you have to tell him what he is doing and what he is doing. So, for example, if you tie a cuff, you have to explain to him, I am looking for a blood pressure. I am going to tie. It's a little painful when I push. Some people push. No. There is some bedside etiquette. Bedside etiquette. You should be very humble. You should Greet the patient. Hello, good morning, how are you? Take the patient name, salute him. If nowadays, because of COVID, we are not just assurance, putting a hand on the back of the patient solves 50% of his problem. Now, most of the infections, clinical signs and symptoms are psychosomatic. Either they fight with their in-laws, or they fight with brother, or some land issue is there. So either they're fighting with the boss or fighting with, of course, husband and wife in fight is 100%. Some in all psychosomatic. It's all deflects on the body. So most of the thing, if you reassure, put a hand across the patient and say you will become all right. I am there. Just put a hand, take his hand, look for pulse. Then he say, I'm going to check your blood pressure. Then tell him, I'm going to check your blood sugar. So you are little obese, you have to reduce weight. Put it. You should not say obese. You should not tell person who is fat. Should not say. You should say you are look prosperous. आजकल बहुत घी बहुत ले रहा है, अच्छा अच्छा खासा मोटा दिख रहा है. Patient will also feel happy. So no, even old people, you should not say old. Look like a senior person, very, I mean, you're aging nicely. What's your age? Can I ask your age if you don't mind? That's the way how you interact with the patient. There's a lot of intricacy in practice. Practice is so many things. See, for example, if you look at checks, like now it's all computerized. There is no human relationship. Hey, hey, you are suffering from tuberculosis. Huh? You are spreading everybody. It's very bad disease. No, lungs will destroyed. Huh? Sometimes we have to do lobectomy also. No? Very bad. Go. So if you, now it's a consumerism. Even if you reveal the diagnosis in the consultation room where 20 people are waiting for you, come out and say you are suffering from tuberculosis, he can sue you in the court. So a lot of confidentiality has to be maintained in a professional. That is what you are going to teach in AdCom modules. How you take the sample from the patient, how you, even if it is stool sample, blood sample, urine sample, throat swab, ear swab, conjunctival swab, whatever sample you take, you should be very careful how you come across as a patient. That's the most important thing in your life. That makes you a good doctor, good human being. There is two things: sympathy and empathy. Sympathy is you should show to the patient. Empathy is you should not suffer from what patient is telling and all. Most of psychiatrists are empathetic and they become more 67% of psychiatrists are drug addicts because they cannot tolerate listening to the stories of patients. They become drug addicts. So you should be very honest, humble, and you should tell the patient what you are doing, explain to him, and all this. Now coming to the laboratory diagnosis of this thing, most important is we do ELISA. So I'll tell you, a lot of students are confused about ELISA. ELISA stands for enzyme linked immunosorbent enzyme linked immunosorbent assay. Enzyme linked immunosorbent assay. You can see the microtiter plate and you can see there will be 96 wells in each well. So you are detecting antibodies against HIV virus. You are detecting antibodies against HIV virus. So sometimes you detect antigen, sometimes you detect antibodies. Here we are detecting the first antigen to appear in the blood after this thing is P224 nucleocapsid antigen. This is the early marker of HIV. So defined incubation period, entry of organism and development of signs and symptoms. Here it is a window period. Window period is defined as entry of virus and development of antibodies. And it is also called as seroconversion. It is also called as zero conversion. It is also called as zero conversion. It is also called as. So incubation period is different from window period. Incubation period is entry of organism and time gap between the entry of organism and development of clinical signs and symptoms. Window period is entry of virus and development of antibodies. That's also called as zero conversion. So most of the time we do ELISA. One is direct ELISA. Second one is indirect ELISA. Third one is sandwich ELISA. It's also called as capture ELISA. Okay. Now this is a microtiter well. So HIV antigen is coated. Then you add the patient serum coated with enzyme horseradish peroxidase. HRP, horseradish peroxidase. Then you add the substrate. If the antibodies are present, then there will be change in the color. It will be yellow color, read by ELISA reader. This is positive. This is direct ELISA. Indirect ELISA, every time you can't prepare, you have a common antibody against all the viruses. First you add human serum, patient serum, then you add second antibody. Second antibody is nothing but anti-human gamma globulin. Anti-human gamma globulin tagged with HRP. Then add substrate. There will be change in the color. There will be change in the color. Then it is positive. Then it is positive. Now capture ELISA. You have to capturing the antigen between two antibodies. You add specific antibodies against that virus. Then you add to detect antigen. Antigen between sandwich between antibody, specific antibody, then anti-human gamma globulin, which is tagged with HRP. Is tagged with HRP. Now add substrate. Then there will be positive. So this is the direct ELISA, indirect ELISA, and sandwich ELISA. This sandwich ELISA is used for detecting P24 antigen. P24 antigen. P24 antigen. This is a laboratory diagnosis of HIV virus. So now, what are the things that you should follow? Like actually, tomorrow also I'm dealing with the same thing at home modules about 3 C's before HIV infection. Consent. Without taking signature of the patient, you cannot just pull and take the blood and do the HIV testing. You should take the consent. You should fully give the consent to undergo the testing. Confidentiality. You should not reveal the HIV positive status to any other person except the patient. Okay. Now counseling. Counseling plays a very important role in the HIV testing. Now coming to the screening test, that it is ELISA takes little longer time. We have ICT, immunochromatography, that lateral flow test is there. So it should be confirmed by what we do is Western blot technique. Instead of this, procedure is same, but we put many antigens. The antigens which are put on This Western blot is nitrocellulose paper. We have a strips of antigen coated onto the nitrocellulose paper. What are the antigens that are put? That is 24, GP24, 21, GP140, P24, 18, P18. So all this antigen put on the nitrocellulose paper, and same procedure is followed, and if it is more than 3 bands, then it is positive. ELISA, I told you already, it's easy and takes little time, 1.5 hours time. Now rapid test is for immunochromatography, that is done by immunochromatography. That is, this is like a card, okay. This is a positive control. This is HIV1 antigen. This is HIV1. This is HIV. We put the serum and substrate and look for the color change. If color is changed, it is positive. Okay, that is immunochromatography. Now Western blot is confirmatory to do the multiple tests. It is put on nitrocellular papers. The antigens that are used are P24, GP120, GP160, GP1. So P24 is the early antigen that appears in the, that is done by capture ELISA, antigen sandwiched between the two antibodies. So what are the uses of capture ELISA for detection of P24 antigen? For confirmation 1, for diagnosis 2, and for the diagnosis of HIV AIDS when it's going to the CNS infection, diagnosis of HIV in infant, and monitoring ART drugs, resolution equivocal to the blot results. Now coming to the, you can detect complementary DNA. You can prepare a complementary DNA, or you can detect RNA by RT-PCR, real-time PCR. So next is monitor the cd4 count. The moment it falls less than 200, you should start antiretroviral treatment. Now we have got a machine in our, we are starting antiretroviral treatment here only. Our technicians and lab people are trained, and we have got a CD4 counter, and machine has come. Where anybody is willing to undergo, you can do it free of cost. We are running a test. Okay. So there is a organization called NACO. NACO stands for AIDS Control Organization India. National AIDS Control, right? National NACO. National AIDS Control Organization India. They form the strategic tests for the diagnosis of HIV, depending on the situation, condition, and how to give positive result and negative results. Okay. Now, the window period I told you, appearance of antibodies and entry of virus. Approximately now, earlier it was called as slow virus. Now it has become very fast. Zero conversion takes place within 2 to 4 weeks. So if the person is in a window period, for example, we come across a lot of patients. They come out, say that I had a sex with so and so, about 1 week back. I want to, what will do, Vishnuvardhan? How will you prove that he is HIV? He is in the window period. How do you prove? Balaji, how will you do? You have to do a viral assay, RNA count, viral load in his blood. So that is early, before appearance of antibodies. You have to see the viruses in the blood. So HIV RNA testing is done by RT-PCR. It's the best method. Detects HIV RNA around 10 to 14 days post exposure. Post exposure, having sex with the commercial sex worker. There are two groups of drugs which are I was using. Now newer drugs have come. Now HIV is fully treatable. It's like hypertension and diabetes mellitus. Nobody should commit suicide thinking that he is HIV positive. We tried vaccine, but Bill Gates and Melinda Gates did poured tons and tons of money in the preparation of vaccine. All over the world, they tried vaccine against this HIV. It is not possible because you see the number of antigens 24, 40, 24, 55, 66, 18. So many antigens are there. You can't have vaccine against so many antigens. Malaria, it's not possible. So many things. And don't condemn the sex, condom it. Rubber is the only answer to prevention of these. So, for example, if somebody comes for the blood donation and says he had a history of sexual exposure about 1 week back, what will you do? So, all the blood banks have kept a counselor. So, if they come out and they have to confess that there should not be any history of sexual exposure with commercial sex work 3 months prior to the HIV infection. Blood donation. All the blood banks we have one counselor who counsel for HIV testing, as well as they'll take the history of sexual exposure by 3 months prior to the blood donation. So these are all questions to be addressed when HIV diagnosis comes to the model. Please one, HIV is confidential. Number two, you should counsel. Number three, confidentiality, counseling, and consent. Consent, confidentiality, counseling. Consent, three C's. Consent, first is consent. Second is counseling. Then third one is confidentiality. I had one case, a strange case. I must have told you already. It was a story like Hum Aapke Hai Kaun. Anybody has seen Hum Aapke Hai Kaun? Madhuri Dixit, Salman Khan. So father-in-law and younger sister comes with husband saying that first daughter is died because of HIV infection. He wants to marry a second daughter. Sister only, Sali. Wife's sister he wants to marry. And he brings us and shows me HIV negative report, non-reactive HIV. What I should have done? Miya bibi raje hai to kya karega kaji. So what I should have done? They asked me, what is your advice? I would have been jailed. Immediately I took his blood. I did tridot. He was positive. I told him, not possible. So I convinced him in such a way that you can get a better boy than this. Don't marry this person because he's not good match for your second daughter. So there are a lot of, this HIV has become a very, very important viral infection in present scenario, because if you are thrown out of once, I had gone to several courts. Because I was giving antiretroviral drugs and I was diagnosing HIV. I was head of ICTC in Rajarajeshwari Medical College, and when first kit was introduced, when I was doing post-graduation in '84, we asked all the doctors to undergo testing free of cost, like how we got cd4 count, cd4 counter. Nobody came forward and to undergo this testing. And then there was a rule from Government of India saying that all foreigners who come from outside India, all students who are studying in Bangalore, you should go to those colleges, take their blood and do HIV testing. With a got first aborts kits, so many kits now available now. But principal used to make sure that no foreign students be around when we used to go there. We used to inform them. The students should be gathered, we take the blood and do HIV testing. If they are found positive, will be thrown out of this country. It was not possible. There are so many stories to tell about HIV testing. If I go on telling, it will be tomorrow morning. So I come across a lot of HIV patients. So please don't only the hand washing, or hand shake handing using towel, toothbrush do not transmit from person to person. So only the confirmed modes are blood transfusion, vertical transfusion, needle stick injury, tattooing, the breast milk, vertical transfusion. So HIV testing is very problematic. If you want to do HIV testing, so you should be very careful. You should take the counseling consent, then only go ahead and do it. So any questions regarding HIV testing? Any questions? No, huh? No questions. If you don't ask questions, either you are not understood or you are just listening, not understanding anything. Okay. Am I right? Both. What? It does not, if you go to any oration, for example, Infosys, Wipro, and a lot of companies call us about regarding hepatitis B and HIV and HCV and all the blood. We conduct blood donation camp, and whenever you're doing blood donation, we keep on talking about the HIV, HBsAg, and HCV. A lot of questions that comes out from the layman, so this, that, this thing, and all these things. So nothing like casual sex. See, you should be very careful. Free sex, मुफ्त में sex करने का नहीं. If it is available, don't ignore it. If it is there, just think that, just rub off and come off. Okay. Then if you want to do it, use rubber condom. Okay. Take care. Be safe. Don't get all sexually transmitted disease. You want to have a sex. Okay. Thank you very much. Proceed to the laboratory where we'll instruct how to write your record book. Thank you.